just absolutely inhumane.
These parents have adult children who've been conserved by the Department of Developmental Services.
I walked by his bedroom with his Elmos, knowing that that's where he should be.
We spoke with a number of families for our investigation, The Price of Care Taken by the State. Yet the national panel of 10 experts that was created in response to our investigation did not.
These are parents who are begging for access to their child. And the fact that this national committee did not even take the time to listen to their point of view makes this whole report very problematic.
Disability Voices United President Judy Mark has serious concerns about the review.
This national panel held 5 meetings and 4 focus groups. I was part of one of their focus groups of advocates.
Mark wonders why the panel did not question if DDS, a massive state agency, should be conservator at all.
It doesn't happen in most states in the country, and we just shouldn't be doing it.
Our investigation uncovered how DDS obtains conservatorship and then gives the responsibility of caregiving to their own regional centers, agencies that provide first-hand services to clients with disabilities.
The agencies that are actually serving as the day-to-day conservators are the agencies that are the decision makers about what services a person receives. So there is actually no advocacy happening for this individual in their lives. They are locked away.
The report showed that 81% of those conserved by DDS are then moved into third-party facilities.
These settings are very institutionalized. We know that there are high levels of abuse.
These facilities are where Garth Schutte and Andrew Finley live, 2 men conserved by DDS that we highlighted in our investigation. When DDS moved them, their families had no idea where they were.
They would not even say, "Is he in Sacramento?" We did not know.
Prisoners, they get visitors. My child's not allowed any of that.
A 2022 state audit also found DDS is not properly monitoring these facilities.
These individuals should be moved out of these institutional-like settings into more individualized housing arrangements with person-centered services.
Because regional centers do this for other clients, we know it can be done.
And this report should have made this recommendation.
But there was also a number of recommendations Mark was pleased by.
To increase education and training for regional center staff, self-advocates, and family members around alternatives to conservatorship.
She's pleased the panel recommended that those conserved should have a thorough review to hear what they want.
What are their desires? Who do they want to be with? Where do they want to live?
But these recommendations are massive undertakings for an already overwhelmed system.
How are regional centers supposed to be implementing this without funds, because all the budgets are tight right now?
Barbara Eimel was a regional center service coordinator, the DDS employees who actually work one-on-one with clients. She left to get her doctorate researching this system and uncovered an alarming finding.
Each regional center is doing something different.
An issue the national panel recommends should be changed by DDS writing guidelines to create consistency across regional centers.
Those types of things, I think it's really important because that's not happening right now.
She's concerned the panel's recommendations would add more to service coordinators' already overloaded plates.
I don't feel it's fair to just put it on service coordinators and have them absorb the extra work.
How this is all going to work is a question both she and Mark have.
And I think it's intentionally vague.
We still don't know on whether these recommendations are actually going to get implemented.
We asked DDS 5 questions, including if they plan to implement these recommendations, if so, when, and with what money. They did not answer most of our questions, but said in part they're reviewing the panel's recommendations and are making some changes now and plan to in the future, but gave us no specific times. And while experts are pleased to see the start of some desperately needed reform, those we highlighted in our investigation are still at their wits' end, unable to be with their family members.
The fact that he's not allowed to spend time with his family it's just a crime.